Good afternoon and welcome to the ConnectureDRX Voice of the Medicare Consumer Survey results. 2023 was the 12th year of surveying healthcare and Medicare consumers regarding their shopping and buying behaviors for healthcare insurance. Over the past 5 years, we've surveyed Medicare beneficiaries, primarily with small subset ages of 62 to 64, to get their perspectives of Medicare prior to becoming Medicare eligible. We conduct these consumer surveys every year following AEP. I'm Josh Smith, Senior Director of Carrier Relations with ConnectureDRX, and I'm here today with Kara Tarantino, the Senior Director of Marketing, also with ConnectureDRX. I'm going to first share a little about our company before we dive into our survey results. So you may see the hashtag #ChooseConnectureDRX on LinkedIn and other social media. And we don't put that in there haphazardly. We want you to know why we believe that you should choose ConnectureDRX. In the past year, we added the trusted source to our brand. This tagline came in when we surveyed our customers. Time and again, it was our customers and partners who said they rely on us to be their trusted source for all things Medicare. And to uphold our responsibility as the trusted source, we strive to consistently offer the most personalized experience for your agents and members to drive acquisition, engagement, and to protect against plan disenrollment. Of note is also in your decision work with us is that ConnectureDRX has a forever home in Harris Computer Systems and Constellation Software. We are not backed by private equity and are financially solid. What that means to you is that we have a strong customer and partner base, along with the ability to reinvest 30% a year into R&D and to stay consistent in developing innovative technologies. Before we dive into our survey results, I wanted to share some of our data highlights from the last year. As of the end of 2023, we've had more than 50 million unique senior profiles on our platform. This number jumps up to 65 million when we include anonymous shoppers. There are 6,500 plans on our platform last year with nearly 1,400 special needs plans. And we had 1.65 million Medicare enrollments as of December 2023. If you'd like to see our growing list of carriers and plans types by state, I encourage you to visit our carrier map on connecture.com. We update this page monthly. We also introduced many new features on our Plan Compare One and Plan Compare Edge platforms last year. Here are some of the highlights I thought you might find interesting. We have 4 value-based care partners on our platform. This is an exceptional post-enrollment engagement tool where agents and seniors can take virtual facility tours and schedule initial primary care appointments, among others. 38 multi-carrier agencies participated in our value-based care program. There are over 5,000 enrollments since the summer of 2023, 125% increase over the prior year. Via our Plan Smart analytics tool, we saw that 40% of seniors were able to save on their health plan, with the average savings of $720. As a result, more than 13% switched to a better fit plan that saved them money. Clearly, enrollment in special needs plans were way up due to COVID, more Medicaid eligible seniors, and the vast number of new plans being offered. We completed more than 150,000 eligibility checks with 22% broker enrollments. If a senior is in a plan and then finds out that their drugs are not covered by the plan's formulary, then what? Or the formulary drops and the drugs from their program. 10% of seniors used our program to find alternatives for drugs via our extensive therapeutics drug database to ensure that they had their medications and saved money as well. I hope you found this info about ConnectureDRX helpful. And now, Kara, I'll let you get sharing on some of our Voice of the Medicare Consumer Survey results.
Great, thank you, Josh. Every year, In our Voice of the Consumer survey, we survey nearly 2,000 seniors immediately following AEP. And we're paying attention to how and where they purchase their Medicare plans. Do they use agents in selecting a plan? The reasons for staying with the plan, the reasons for switching plans, overall plan satisfaction, and more. Note also that we look not only into why seniors change particular plans or plan types, but also why they chose a given brand and carrier as well. We'll try to make this distinction clear in our discussion. Our demographics are very similar to what we saw in 2022. In 2023, 64% of our surveyed population were female and 30% male. 75% were retired, a quarter were still working. Additionally, as Josh mentioned, we survey about 10% of those leading up to age 65 to get their perceptions of the information they see regarding Medicare prior to being eligible for actual Medicare enrollment. And regarding how they feel about their health, only 16% said their health is excellent. Most say they're in good or very good health, and 5% said their health is poor. This slide shows that 60% of seniors have Medicare insurance only, no other insurance. In 2022, 69% had Medicare only. This drop could indicate that seniors are now working longer and staying on their employer's benefits program, due in part maybe to rising inflation and increasing costs of goods and services. This slide shows a glimpse of the type of Medicare coverage our seniors carry. There was a big bump in original Medicare holders last year. In fact, we saw a 12% increase over 2022. Interestingly, the number of people carrying original Medicare, 65%, went back to the same level as in 2019, which was a pre-pandemic year. An equal number of seniors have Medicare Advantage and PDP, about 38%. 22% have MedSup, which is up 6% from the previous year. And as a reminder, those who carry MedSup also have original Medicare. So maybe the increase in original Medicare was due to the interest in having a MedSup plan this year. Here's also a glimpse of how the plan type breaks out based on age. While most of our respondents have original Medicare, it was the older seniors, those 67 and older, who were more likely to have a Medicare Advantage plan. 2023, 43% of those 67 and older chose a Medicare Advantage plan, and only 36% of those age 65 chose one. The age difference was not as great for those selecting a MedSup plan. And here we see that nearly half of all Medicare plan purchasers look at only one carrier before purchasing a plan. 40% of beneficiaries look at 2 to 3 carriers, and a small subset, 12%, evaluate more than 4 carriers before making a decision. And here we look at the number of plans considered. More than 80% of seniors look at 1 to 3 plans before deciding. 15% consider 4 to 6, and a small percentage, only 4%, look at 7 or more plans. Here we looked at seniors, how seniors compared plans, again, based on age. Younger seniors in the 65 age group tend to use Medicare.gov site or even call an agent directly to compare plans versus older seniors. 16% of older seniors did not compare plans or carriers. This contrasts with 27%, nearly a third of the older seniors, 67 plus, who did not compare plans. So even with resources available to them, they are not likely to compare plans like the younger seniors. It could be because they are more familiar with Medicare, their plan, and are more comfortable with not looking at their options, whereas it's all pretty new to the younger seniors just getting into Medicare. And now I will pass it back to Josh for some more results.
Thanks, Kara. Let's talk about some agent data. Agents are a critical resource for seniors when researching and shopping for the right Medicare plan. Here's what here's what is most important to seniors that we surveyed when researching, shopping, and when they're shopping for insurance. 30% said calling a broker I trust for advice is most important. 29% said they prefer to shop and enroll online with little assistance. 12% said they like calling an insurance company or health plan that they trust directly, and only 9% rely on friends and family for advice. So what matters most to seniors when plan shopping? Our year-over-year results have remained consistent with what matters most to seniors when shopping for a plan. 44% say that they saw a low monthly premium or zero premium is the most important factor in choosing a plan. 24% say it is keeping with their current doctors. Going with a trusted brand and having prescriptions covered by their brand is about as equally as important, and 7% want a lower out-of-pocket estimate for the year. So how long does it take to enroll? Most only take about an hour to enroll in their chosen plan. Nearly a third of seniors take 1 to 2 hours, and 18% take more than 3 hours to find and enroll in a plan. And what about satisfaction with their shopping experience? Year over year, seniors are satisfied with their Medicare plan shopping experience. In 2023, we found that 68% of seniors were either very satisfied or satisfied with their Medicare shopping experience. Nearly a third were neutral regarding their shopping experience, and as you can see, very few were dissatisfied. One thing that we're seeing more and more is that seniors are staying with their carriers. And in 2023, 66% of the respondents stayed with that same carrier. This increased 9% from the previous year of those who stayed with the same health insurance carrier or brand in 2022. And in the next slide, you're going to see why they chose to stay. Trust is the biggest factor in this. Overall, seniors trust that their carriers have been happy with them. If they have been happy with the same carrier brand, they tend not to shop around. Here, you can see that trust is the top reason year over year that seniors stay with their current insurance carrier or brand. Only 14 to 16% stayed with their carrier after doing research and then finding out the carrier was the best option for their needs. The number who stay with their carrier because of doctors on the plan, broker guidance, out-of-pocket costs, and prescription drug coverage is low compared to the importance of trust. And now switching back to Kara to talk about plan switchers.
Thanks, Josh. So plan switchers are down from 2022 by a significant amount. 34% switched plans in 2023 versus 43% who did in 2022. As you can see here, last year was the lowest percentage of plan switchers over the past 5 years. Pretty interesting. So why switch? It's no surprise today that cost really matters to seniors more than ever. 24% of seniors switched to a different plan because they found a less expensive plan with a different carrier. 19% of plan switchers did so because their broker guided them to a better fit plan. And the number of seniors who chose a new plan because they wanted more supplemental benefits such as dental, vision, etc., dropped in 2023 by 11%, down from 21% who switched for the same reason in 2022. And it looks like there were more plan switchers last year than in prior years because their current plan was no longer available. And regarding completing enrollments, more than half of our seniors surveyed enroll in their Medicare plan online and independently. 32% enrolled with the help of their agent, 17% enrolled by calling a call center. And how did seniors interact with their agents? Last year, 49% of seniors preferred to talk on the phone with their agent. Of note, this is also about the same as in 2022, but down 56% from 21. 15% prefer email, Again, this is down about 5% from 2022, and 14% met in person, about the same as in prior years. Few still use text to communicate with their agents. Of note also is that 54% of the younger age group, those just aging into Medicare, prefer to speak with their agents on the phone, whereas only 44% of those 67 and older preferred the phone. Older seniors also prefer email to younger seniors overall. So regarding virtual interaction, this slide shows the opinions of seniors and the value of those virtual interactions, excuse me. 54% find virtual engagement as helpful or more helpful than meeting with their agent in person. Nearly a third still met with their broker or agent in person. 17% engaged virtually with their agents, but did not find it as helpful as their in-person meetings. Remember, these are just their perceptions of the value of these virtual interactions. So with that, I want to thank you for your time today. Please visit Connecture.com, connect with us on LinkedIn, Facebook, and visit our YouTube channel for not only marketing videos, but also playlists of important features on our Plan Compare One platforms, Plan Compare Edge platform, and also a special note that our Plan Compare Edge solution for small to mid-size agencies will be available also for for independent agents in the not too distant future. And if you are interested in that, please reach out to us so we can make sure that you are on our distribution list. And we look forward to seeing you on future webinars. Thank you for your time.